Hi, this is Christy Shunn, the Executive Director of the Kansas Infant Death and SIDS Network, or KIDS Network. The mission of the KIDS Network is to serve those who are or may be touched by the tragedy of infant death or SIDS by providing supportive services, community education, professional training, and supporting associated research. This presentation, Wrestling with Safe Sleep, is part of the KIDS Network Safe Sleep Certification Project aimed specifically at reducing sleep-related infant deaths. Within our efforts to reduce sleep-related deaths, we must first define what constitutes a sleep-related death. Sudden unexpected infant death, or SUID, is a death of an infant less than 1 year of age that occurs suddenly and unexpectedly. After a full investigation, these deaths may be diagnosed as suffocation, asphyxia, entrapment, infection, ingestion, metabolic diseases, cardiac arrhythmias, trauma, either accidental or non-accidental, or SIDS. A SUID death is where the manner and cause of death are not immediately obvious prior to investigation. Accidental suffocation or strangulation in bed, or ASSB, is a classification used when the terms such as asphyxia, suffocation, or strangulation are reported, along with the terms bed or crib in the investigation report. Sudden infant death syndrome, or SIDS, is when an infant seems to be healthy but dies usually while sleeping for no other reason. It is sometimes called crib death. And in some cases where the evidence is not clear or not enough information is available, the death is considered of undetermined cause or unknown. So what is SIDS? Sudden infant death syndrome is the sudden death of an infant under 1 year of age, which remains unexplained after a thorough case investigation, which must include the performance of a complete autopsy, the examination of the death scene, and a review of the clinical history. To give you some perspective, in 2018, 231 of 36,268 babies born in Kansas died before their first birthday. That is 6.4 deaths per 1,000 live births. The national goal set by Healthy People 2020 is an infant mortality rate below 6.0 per 1,000 live births. 2015 was the first year that Kansas had ever been below the 6.0 goal. To learn more about the issues related to infant mortality, we must look at a 5-year rolling average. From 2013 to 2017, the Bureau of Epidemiology and Public Health Informatics at the Kansas Department of Health and Environment report the leading cause of infant mortality is congenital anomalies, or things like neurotube defects like spina bifida and anencephaly. The second leading cause of death is prematurity or low birth weight. And following very closely are sudden unexpected infant deaths, SIDS, ASSB, undetermined, or what many consider to be sleep-related deaths. Other causes, at 30%, are rare diseases like necrotizing enterocolitis, car accidents, and other external causes. The State Child Death Review Board examines trends and patterns that identify risk factors in the deaths of children from birth through 17 years of age. The Kansas State Child Death Review Board has developed the following 3 goals to direct its work. 1, to describe trends and patterns of child deaths, identifying risk factors in the population. 2, to improve interagency communication so recommendations can be made regarding recordings of actual cause of death, investigation of suspicious deaths, and system responses to child deaths. And 3, to develop prevention strategies including community education and mobilization, professional training, and changes in legislation, public policy, and/or agency practices. It should be noted that the numbers and rates in the Child Death Review Board annual report should not be expected to be that as the same as the KDHE Annual Summary of Vital Statistics, which monitors deaths of Kansas residents only. After review by the board, The classification of the cause or manner of death may be different from the coroner's. For example, an infant death suspicious for asphyxia may be called an undetermined death by the coroner, but after the board reviews medical, law enforcement, and other pertinent reports, additional information may support the board's classification of the death as sudden infant death syndrome. According to the 2017 Kansas State Child Death Review Board annual report, there were 41 sleep-related infant deaths. Of the 41 infant deaths, 27 were found in an adult bed. This means that 66% of the infants were sleeping in an adult bed, and 51% were co-bedding. 83% were not sleeping in a safety-approved crib or bassinet. 7% of the infants were sleeping on a chair, floor, swing, boppy, etc. 7% of the infants were sleeping on a couch while co-bedding. And 89% of the SIDS deaths had one or more elements of unsafe sleep. It is important to differentiate between co-bedding in an adult bed and sofa and couch. Some bed-sharing proponents argue the message, "Don't sleep with infants," leads parents and caregivers to co-sleep on couches and sofas, thus increasing deaths on couches and sofas. However, according to the Kansas Child Death Review Board data, it clearly reports the majority, or 66%, of the sleep-related deaths occur in an adult bed. The Kids Network's strategy to reduce these sleep-related infant deaths is to provide consistent, safe sleep messages along a continuum of care. We strive to educate new and expected parents, caregivers, grandparents, and anyone caring for an infant in the first year of the infant's life. To do so, consistent messaging must be provided in the community, in our clinics, hospitals, birthing centers, and all child care facilities. So how do we go about reducing infant mortality? What we know is that parents and caregivers are most likely to follow safe sleep guidelines when a healthcare provider promotes safe sleep practices. It is also important that the healthcare provider deliver consistent messages. We also know that new parents turn to trusted female friends and relatives. The more people sharing information about safe sleep practices, the more likely families will follow them. And lastly, it's important that providers and educators not only talk about safe sleep, but model safe sleep behaviors. There's an obvious racial disparity between Caucasian people and people of color. African American babies are almost 3 times more likely to die in infancy, and Native American babies are over 2 times more likely to die of SIDS than their Caucasian counterparts. Infant mortality is a complex issue, and social determinants like poverty, education, and chronic stress may influence these rates. This chart describes the leading causes of death by population group. Thus, SUID is the second leading cause of death for Black and white non-Hispanic infants, but third in the Hispanic population. Nationally, Hispanic SUID rates have been historically lower than white SUID rates. However, here in Kansas, an upward trend on Hispanic infant mortality has recently been noted. True SIDS occurs about 1 time a year in Kansas. The remaining sleep-related deaths are thought to be due to accidental suffocation and strangulation in bed, or ASSB. It is believed that true SIDS occurs when the infant has an unknown brainstem abnormality, is developmentally vulnerable, and is exposed to environmental stressors. The brainstem abnormality appears to fit into the triple risk model of SIDS, which holds that SIDS occurs only when 3 elements come together. This theory, developed by Dr. Hannah Kinney at Harvard Medical School, is referred to as the triple risk theory. The theory includes 3 components. 1, an infant who has a subtle brainstem dysfunction. 2, an unstable autonomic nervous system, which is common between 2 and 6 months of age. And 3, an external stress factor such as prone sleeping, overheating, or exposure to smoke. This subtle infant physiological response deficit is like the brain has a malformation or was slow to develop for some unknown reason. This part of the brain has a mechanism that I think acts a bit like a smoke detector. When a room fills with smoke, a working smoke detector alarms you. However, if the smoke detector is broken, you might sleep through the fire. Thus, if the baby has a broken mechanism in the base of the brain, or a broken alarm system, so to speak, the baby is not alarmed and dies rather than crying, startling, or lifting her head. In the triple risk model, SIDS occurs only if all three conditions come together on the wrong night or day. A vulnerable infant during that peak developmental stage is exposed to an environmental factor that he or she, because of his or her particular vulnerability, is unable to recover from. We cannot identify those infants with brainstem abnormalities, nor can we prevent normal development. However, we can intervene by reducing external stress factors, such as putting the baby alone on the back in a clutter-free crib. The American Academy of Pediatrics has published infant safe sleep recommendations to reduce these external risk factors. The most recent guidelines were published in October 2016. The remainder of the presentation will address the AAP's risk reduction strategies. To reduce the risk of SIDS, infants should be placed for sleep in a supine position, wholly on the back, for every sleep by every caregiver until the child reaches 1 year of age. Side sleeping is not safe and is not advised. Data to make specific recommendation as to when it is safe for infants to sleep in the prone or side position are lacking. Studies establishing prone and side sleeping as risk factors for SIDS include infants up to 1 year of age. Therefore, the best evidence suggests that infants should continue to be placed supine until 1 year of age. Once an infant can roll from supine to prone and from prone to supine, the infant can be allowed to remain in the sleep position that he or she assumes. Because rolling into soft bedding is an important risk factor for SUID, all the way up to 1 year of age. Parents and caregivers should continue to keep the infant's sleep environment clear of soft or loose bedding. The supine sleep position does not increase the risk of choking and aspiration in infants, even those with gastroesophageal reflux, because infants have an airway anatomy and mechanisms that protect against aspiration. As this slide shows, babies are less likely to choke when placed supine. When babies are in the back position, the trachea or windpipe lies on top of the esophagus or the food tube. Anything regurgitated or refluxed from the esophagus must work against gravity to be aspirated into the trachea. If medical personnel determine that the stomach sleep position is necessary because of a medical condition or other concern, healthcare providers should be advised to tell parents and caregivers to reduce the risk of SIDS in other ways, such as by avoiding soft bedding and ensuring the infants do not overheat during sleep. For most infants, however, stomach and side sleeping are not advised. Elevating the head of the infant's crib is ineffective in reducing gastroesophageal reflux and is not recommended. In addition, elevating the head of the crib may result in the infant sliding to the foot of the crib into a position that may compromise respiration. Like this photo depicts, infants should be placed on a firm sleep surface, for example, a mattress, in a safety-approved crib, bassinet, or portable crib, covered by a fitted sheet if necessary, with no other bedding or soft objects to reduce the risk of SIDS and suffocation. A firm surface maintains its shape and will not indent or conform to the shape of the infant's head when the infant is placed on the surface. Soft mattresses, including those made of memory foam, could create a pocket or indentation and increase the chance of rebreathing or suffocation if the infant is placed in or rolls over to the prone position. The safety and benefits of co-bedding for twins and high-order multiples have not been established. It is prudent to provide separate sleep surfaces and avoid co-bedding for twins and high-order multiples in the hospital and at home. A suggested alternative to a full-size crib is a safety-approved portable crib as shown here. A crib, bassinet, portable crib, or play yard that conforms to the safety standards of the Consumer Product Safety Commission, or CPSC, includes those with slat spacing less than 2 3/8 inches, snugly fitting and firm mattresses, and no drop sides is recommended. In addition, parents and providers should check to make sure that the product has not been recalled. This is particularly important for used cribs. Cribs with missing hardware should not be used, nor should the parent or provider attempt to fix broken components of a crib, because many deaths are associated with cribs that are broken or with missing parts, including those that have been presumably fixed. Local organizations throughout the United States can help provide low-cost or free cribs or play yards for families with financial constraints. This slide shows two photos of same room, separate bed. This is room sharing without bed sharing, and it's the safest sleep environment for infants. Bedside sleepers are attached to the side of the parental bed. The Consumer Product Safety Commission has published safety standards for these products, and they may be considered by some parents as an option. However, there are no Consumer Product Safety Commission standards for in-bed sleepers. The task force cannot make a recommendation for or against the use of either bedside sleepers or in-bed sleepers, because there have been no studies examining the association between these products and SIDS, or unintentional injury and death, including suffocation. Infants should not be placed for sleep on adult beds because of the risk of entrapment and suffocation. This photo shows an unsafe sleep environment. It's from a magazine spread displaying Jennifer Lopez's nursery for her twins. How many unsafe items do you see in this picture? Stuffed animals, bumpers, fluffy blankets? Soft materials or objects such as pillows, quilts, comforters, or sheepskins, even if covered by a sheet, should not be placed under a sleeping infant. In addition, portable bed rails should not be used with infants because of the risk of entrapment and strangulation. The infant should sleep in an area free of hazards such as dangling cords, electrical wires, and window covering cords, because these may present a strangulation risk. Sitting devices such as car seats, strollers, swings, infant carriers, and infant slings are not recommended for routine sleep in the hospital or at home, particularly for young infants. Infants who are younger than 4 months are at increased risk because they may assume positions that can create a risk of suffocation or airway obstruction, or may not be able to move out of a potentially asphyxiating situation. When infant slings and cloth carriers are used for carrying, it is important to ensure that the infant's head is up and above the fabric, the face is visible, and the nose and mouth are clear of obstructions. After nursing, the infant should be repositioned in the sling so that the head is up, is clear of fabric, and is not against the adult's body or the sling. If an infant falls asleep in a sitting device, he or she should be removed from the product and moved to a crib or other appropriate flat surface as soon as it is safe and practical. Car seats and similar products are not stable on a crib mattress or other elevated surfaces. Infants should not be left unattended in car seats and similar products, nor should they be placed or left in a car seat or similar product with the straps unbuckled or partially buckled. Car seat covers should only be used outdoors, as they increase the risk of overheating as well as trap CO2 in the area the baby is breathing, increasing the risk of suffocation. The Fisher-Price Rock and Play has been recalled by the Consumer Product Safety Commission as of April 2019 and should no longer be used. Be particularly wary of devices that claim to reduce the risk of SIDS. Examples include, but are not limited to, wedges and positioners and other devices placed in the adult bed for the purpose of positioning or separating the infant from others in the bed. Crib mattresses also have been developed to improve the dispersion of carbon dioxide in the event that the infant ends up in the prone position during sleep. Although data do not support the claim of carbon dioxide dispersion unless there is an active dispersal component, there is no harm in using these mattresses if they meet standard safety requirements. However, there is no evidence that any of these devices reduce the risk of SIDS. Importantly, the use of products claiming to increase safe sleep does not diminish the importance of following recommended safe sleep practices. Information about a specific product can be found on the Consumer Product Safety Commission website, cpsc.gov. Some entities are promoting the idea of babies sleeping in cardboard boxes. Many parents assume that a product must be safe if it is allowed to be sold. But to date, none of the boxes meet Consumer Product Safety Commission standards because no safety standards have been set. National organizations such as the American Academy of Pediatrics and the National Institute of Child Health and Human Development have raised concerns regarding infant sleep boxes. Some of those concerns include potential poor airflow, the fact that the box may tip over if placed on an unstable surface. The infant weight and age limits for the box are higher than those for safety-approved bassinets, yet boxes are for sale and have a small sleep surface. Cardboard is flammable. There's possibility of structural damage due to moisture or wear and tear. There is access to the baby by pets and animals. And cardboard can attract rodents and roaches. Breastfeeding is recommended and is associated with a reduced risk of SIDS. Unless contraindicated, mothers should exclusively breastfeed or feed with expressed human milk, not offer any formula or other non-human milk-based supplements for 6 months in alignment with recommendations of the American Academy of Pediatrics. The protective effect of breastfeeding increases with exclusivity. However, any breastfeeding has been shown to be more protective against SIDS than no breastfeeding. Healthcare providers should advise parents and caregivers that a certain amount of tummy time is a very important and necessary part of an infant's development. Infants need 2 or 3 sessions of supervised tummy time every day. Older babies need even more tummy time to help get their bodies ready to sit up, roll over, crawl, and walk. Tummy time should begin as early as possible to promote motor development, facilitate development of the upper body muscles, and minimize the risk of positional plagiocephaly or flat spots. Tummy time needs to be done on a firm surface like a floor. This resistance will help build the muscles in the neck and shoulders. Although the mechanism is yet unclear, studies have reported a protective effect of pacifiers on the incidence of SIDS. The protective effect of the pacifier is observed even if the pacifier falls out of the infant's mouth. The pacifier should be used when placing the infant for sleep. It does not need to be reinserted once the infant falls asleep. If the infant refuses the pacifier, he or she should not be forced to take it. In those cases, parents can try to offer the pacifier again when the infant is a little older. Because of the risk of strangulation, pacifiers should not be hung around the infant's neck. Pacifiers that attach to the infant clothing should not be used with sleeping infants. Objects, such as stuffed toys and other items that may present a suffocation or choking risk, should not be attached to pacifiers. For breastfed infants, pacifier introduction should be delayed until breastfeeding is firmly established. Infants who are not being directly breastfed can begin pacifier use as soon as desired. Infant sleep clothing, such as a wearable blanket, is preferred to blankets and other coverings to keep the infant warm while reducing the chance of head covering or entrapment that could result from blanket use. In general, infants should be dressed appropriately for the environment, with no greater than one layer than the adult would wear to be comfortable in that environment. Parents and caregivers should evaluate the infant for signs of overheating, such as sweating or the infant's chest feeling hot to the touch. Overbundling and covering the face or head should be avoided. There is currently insufficient evidence to recommend the use of a fan as a SIDS risk reduction strategy. Swaddling, or wrapping the infant in a light blanket, is often used as a strategy to calm the infant and encourage the use of the supine position. There is a high risk of death if a swaddled infant is placed in or rolls to the prone position. If infants are swaddled, they should always be placed on the back. Swaddling should be snug around the chest, but allow for ample room at the hips and knees to avoid exacerbation of hip dysplasia. When an infant exhibits signs of attempting to roll, swaddling should no longer be used. There is no evidence with regard to SIDS risk related to the arms swaddled in or out. These decisions about swaddling should be made on an individual basis, depending upon the physiological needs of the infant. Healthcare professionals, staff in newborn nurseries and neonatal intensive care units, and child care providers should endorse and model the SIDS risk reduction recommendations from birth. So swaddle a baby who wants to be swaddled. Make sure it's not too tight, not too hot, and that the infant is unable to flip over. Both maternal smoking during pregnancy and smoke in the infant's environment after birth are major risk factors for SIDS. Mothers should not smoke during pregnancy or after the infant's birth. There should be no smoking near pregnant women or infants. Encourage family members to set strict rules for smoke-free homes and cars, and to eliminate secondhand tobacco smoke from all places in which children and other non-smokers spend time. The risk of SIDS is particularly high when the infant bed shares with an adult smoker, even when the adult does not smoke in bed. Thus, anyone who chooses to smoke needs to go outside to smoke, wear an overcoat while they're smoking, and remove that overcoat before holding an infant. We know that exposure to smoke in a room where babies sleep is linked to an increased risk of sudden infant death syndrome. Mothers should avoid alcohol and illicit drugs periconceptually and during pregnancy. Parental alcohol and/or illicit drug use in combination with bed sharing places the infant at particularly high risk of SIDS and sleep-related death. It is important to emphasize that immunizations or shots do not cause SIDS. Even though the number of immunizations that children get has increased over the last decade, the SIDS rate has decreased. Infants should be immunized. Evidence suggests that immunization reduces the risk of SIDS by 50%. The Kids Network staff, volunteers, and evaluators created the following video to demonstrate how to properly set up a portable crib and discuss safe sleep recommendations so audience have a visual depiction of what we mean when we say safe infant sleep environment. Based on data from the Frameworks Institute, we also learned it is best to show people what to do so they are left with a positive image in their mind. Following is a short video depicting a crib demonstration.
Okay, another piece of the safe sleep education that I think is really important is to show people how to do a crib demonstration. So when you're training folks, show them how to set the crib up and how to create a safe sleep environment. A lot of times we can tell them, but it's when we show them that it really sort of etches in their mind. So I'm going to show you how to set up a portable crib and make it a safe sleep environment. This is a portable crib from Cribs for Kids. These are a fairly new design. But they are safety approved, so I always let parents know that you can buy a full-size crib, but you can also use a portable crib like this one. They are about $40 to $50. They are approved for child care providers as well as parents. And when you're setting it up, what you need to remember is that there are joints in each of the sides. And there's two, and so they both have to click up before you can put the base of the crib down. So you press that down in the center once all of the braces are up and sturdy. If you're looking at childcare and you have a baby that's over 2 months of age or can flip over, this is the way you want to use the portable crib. But for the new family that has less than a 2-month-old or is not doing childcare, they can use the bassinet feature, and that is this mechanism. And basically it just goes in and clicks over each of the sides. You want to make sure they're taut so there's no gaps along the sides. And these should snap on fairly easily. So make sure there's no extra material that's a hazard. They have 2 braces in the bottom that will then hold the mattress in place. There's also Velcro under each side to make sure the mattress stays where it needs to be. The other thing I really like about these portable cribs, in addition to the fact that they're, $40 to $50, makes it much more economical for people. It also has the ABCs of safe sleep. That's another reminder to the caregiver to always put the baby alone on the back in a clutter-free crib. It also has mesh on 2 of the sides, which just allows more airflow, and then has instructions and warnings on either end. It's also made out of a material that you can clean with like a disinfectant wipe or such like that, where you don't need to have a crib sheet in here. If you're talking to childcare providers, they by regulation have to have a crib have to have a crib sheet, and so we make sure that they are buying a crib sheet that fits the actual portable crib and not one for another size bed. But for a parent or a guardian, they can utilize this without putting a sheet in there. So if you want to know and show what a safe sleep environment looks like, you put the baby on its back in this portable crib with nothing else in the crib, except possibly a pacifier. So we encourage people to consider using a pacifier at nap time and nighttime. This will reduce the rate of SIDS. If they don't want the pacifier, we encourage people not to fasten it in any way to their clothing. And if they don't like it, that's fine. You'll also notice that this baby is using a wearable blanket so that we don't have to have loose bedding or any loose blankets in the bed. And right now she's swaddled with her arms out. So when the baby gets old enough that they can flip over or they look like they're going to flip over, we want to make sure that they're swaddled with their arms out so that it's not too tight and so that they can get back onto their back if they want to by using their arms and exercising their shoulders. If you have a baby that is under 2 months, not able to flip over, likes to be swaddled, isn't too warm, you can go ahead and swaddle the arms in. And it would look like this. But the recommendation is that when the baby looks like it can start flipping over, and sometimes that's 4 weeks, sometimes that's 6 or 8 weeks, make sure you take their arms out. So that is a safe sleep environment. Some of the other things that I want you to talk to parents about and caregivers is things not to use. So often people like to put hats on the baby, and these are really helpful when it's 30 degrees outside and you're going from the car to the grocery store or back into the house. But once they're in the house, we want to take the hat off, because one of the things we don't always think about is the head is where we regulate our temperature. And so if you've covered their head and they get too warm in the house, they've lost one of their safety mechanisms. So hats are great, but they're really more for outside and not for sleeping. We also know that one of the things that makes the bedding or the sleep environment unsafe is portable or diapers and wipes. And these are just something that collects in the corner. So we're going to highly suggest that when you change the baby, even if you change them in the bassinet or the crib area, that you take them and put them somewhere else while the baby is in there so it can be alone on the back in a crib. A couple of the other things that we don't always think about, and I've had a number of parents say, this just feels like it's a little bit too firm. It's actually perfect for an infant. We want to encourage them not to use any pillows or not to try to make it any more cushy than it already is. What people don't always think about is that the pillow becomes a hazard because the baby may roll off and then they start rebreathing their carbon dioxide here or might suffocate. Or they lay in the middle of the pillow and this is very porous, and so they can't lift their head out of it, they can't tilt their heads because they just don't have the neck strength and the shoulder strength that they have when they get older. So pillows are great for adults and extremely dangerous and hazardous for babies, especially in a crib area. Another big culprit that we struggle with is the blanket. We already talked about the wearable blanket. These seem to creep home from hospitals, and they certainly do use them in a lot of hospitals across the country. They're great, again, to use blankets when you're going inside and outside from the car to the grocery store or to your own home. But really, when they're sleeping and when you're swaddling them, the babies kick out of these pretty quickly. And then the concern and the hazard is that it might get up around their mouth area or just anywhere around them so that they start rebreathing their carbon dioxide, and then that becomes a hazard to the baby. So leave the loose blankets out of the bed and choose either to dress the baby warmly enough or to utilize some kind of a wearable blanket. So back to what safe sleep looks like. It's just the baby on her back in a wearable blanket, pacifier if she likes it, but again, we're not attaching it in any way. You'll also notice that, especially with these portable cribs, there's no need to have bumpers. Bumpers are lethal to babies, whether they're in a portable crib or a full-size crib. So now we know that a full-size crib, the slats are close enough together that you don't need to have a bumper. So all bumpers, positioners, wedges need to be outside of the bed. They are only hazardous. And a lot of times people are thinking, this is on the market. It must be good for my baby because I can buy it. And that's not actually true. So anything that people are thinking about buying, I encourage them to go to Consumer Product Safety Commission or cpsc.gov and check out the different things. But some of the things that go under the baby to supposedly hold them in place actually end up being more hazardous than good. It usually holds them in place when the baby can't move anyway. And so then when the baby does start to move around, it becomes an air hazard where they start rebreathing their carbon dioxide again. So the only thing a baby needs to sleep safely is a safety-approved crib, portable or full size. They need to be placed on their back alone with nothing else in the crib except the pacifier. So again, you can get cribs in a number of places. You can buy them online. You can buy them in discount stores. A lot of hospitals have giveaway programs now, health departments. I really encourage you to call your local resources. We're trying to get portable cribs across the state of Kansas so that people can have easier access to them. But they're obviously, available in many places online and in stores across the state and the country. Again, I would just refer people back to Consumer Product Safety Commission because they will recall everything and stay up to date on that. So that's the best place to check out the specifications of your crib.
The National Institute of Child Health and Human Development Back to Sleep materials became available in the 1990s. They were updated in 2017 to the Safe to Sleep materials with the new American Academy of Pediatrics recommendations. Resources can be found at nichd.nih.gov. These Safe to Sleep campaign materials are 8.5 by 11 posters. They too have been revised to reflect the 2016 American Academy of Pediatrics updated Safe Sleep recommendations. These tear-off sheets are great to use in the hospital setting, childcare settings, and clinic settings. Go to nichd.nih.gov for more information and resources. This Safe Sleep video was written and created by Safe Kids Kansas in partnership with Lawrence Memorial Hospital, Child Care Aware, the University of Kansas, Parents as Teachers, and the Kids Network. The video was produced in 2010 and reflects the recommendations at that time. The American Academy of Pediatrics has revised recommendations that are not included in this video. To view this video, go to safesleepkansas.org. Research shows that when SIDS happens in childcare, it frequently happens very early on. There is question as to if it is related to the change in environment and sleep position, thus stressing the need to have the conversation with childcare providers about correct safe sleep practices. On February 3, 2012, the Kansas Department of Health and Environment child care regulations were updated to reflect the following legislation. KAR 284114A, Initial and Ongoing Professional Development, states at least 2 clock hours of training on safe sleep practices and sudden infant death syndrome if the individual will be caring for children under 12 months of age, and KAR 284115A, under supervision, states each child who is napping or sleeping shall be within sight or hearing distance of the provider and shall be visually checked on by the provider at least once every 15 minutes. Some child care providers might be reluctant to tell parents what to do and find it easier to give in to the parent's preference. It may be a good idea to designate a couple of people in the child care facility or home to be the point people on safe to sleep issues. When there is a parent that is concerned about the policy or is uninformed, these point people can be responsible for speaking with them. Know that what you share with the parent might be the piece of information they have been missing in the care they provide their child. Although they may have heard the information before, you might be just the right person who gets through to them. Why would a child care provider be reluctant to discuss the situation with the parents of a child in your care? Ideas? Some of the benefits of creating a safe sleep policy in the home or child care facility will show the parent that baby's health and safety is the child care provider's top priority. Safe sleep policies help educate child care staff. It promotes consistent care. As we said, it also educates parents. It empowers the child care provider. It reduces the risk of liability. And to view some policy examples, you can go to kidsks.org. This presentation is available online at Kansas Train. Go to ks.train.org and use the course IDs on the screen to locate the training. The trainings take about 1.5 to 2 hours. The training includes a pre-test and post-test and will provide a certificate of attendance at the conclusion. Although this training was created for the child care providers, others are advised to take part. This slide provides contact information for the National Resource Center for Health and Safety in Child Care and Early Education. Reducing the risk of sudden infant death syndrome, applicable standards for caring for our children, National Health and Safety Performance Standards, guidelines for out-of-home child care is readily accessible and easy to use. On this website, there is also information about licensing regulation for each state. You can check the details of your state's regulation. This slide provides the contact information for the American Academy of Pediatrics Early Education and Child Care Initiatives. You can find specific information regarding to safe sleep and child care here. As described early in this presentation, the Kids Network mission is to provide community education, like this presentation, and bereavement services to those grieving families. If you are aware of a family that has been bereaved at any time, please refer to the network. The network would ask that you first let the family know that you'll be contacting the Kids Network to provide support, and they will in turn call them. You can provide this referral information in a number of ways. You can contact the Kids Network by writing 300 West Douglas, Suite 145, Wichita, Kansas, 67202. You can call the network at 316-682-1301 or fax the referral information to 316-682-1274. There are bereavement referral forms on the Kids Network website that can be found at kidsks.org. This is the conclusion of the presentation, Wrestling with Safe Sleep. Listed below are the references used to collect the data and recommendations found in the slides. And finally, this presentation was developed and copyrighted by the Kansas Infant Death and SIDS Network. Go to kidsks.org for more information. If you have any questions about the material provided, please contact Christy Shunn at the Kids Network. Thank you for listening, and thank you for the work you do keeping infants safe.